Kennedy Mukuna. I am a co-founder and product lead at Afyakit. We're a health tech startup, and our main focus is on the quality of care management in hospitals in sub-Saharan Africa. The problem that we specifically look to address is a lack of actionable data for decision making in the health sector, particularly in health facilities in sub-Saharan Africa. And what we are doing about that is essentially built a platform which has an array of assessment tools, and those tools essentially provide a way um, for hospital administrators and for hospital managers and also government regulators to essentially assess the quality of care that's being provided at different hospitals, regardless of the size of the hospital, the level at which it is. And actually what the platform ends up doing also is consuming these data points into very easily understood, very easily and very quickly easily comprehensible indicators that any health manager will be able to look at and immediately understand they need to actually implement in order to kind of maintain or improve the quality of care they are delivering. What do I mean by this actually? So our platform right now, for instance, we do have a tool that specifically assesses the ability for hospital or health facility to essentially provide maternal neonatal care. So we essentially collect over 300 data points of that assessment tool, and on the back end the platform takes that information, combines it, and actually produces indicators which any health facility manager will very quickly understand what they need to do about that. For example, we produce indicators called EMONC indicators, which essentially enable a health facility manager to understand, are they able, for instance, to administer specific antibiotics that a pregnant woman or like a delivering mother will need. Are they able to provide like specific services to like a newly born child? For instance, if the child came in with difficulty in breathing or potentially unresponsive, can they resuscitate that child? Among the indicators that we actually measure, one of them very specifically measures the capacity for a health facility to resuscitate children who are unresponsive. Now, all this put together, we actually have a few use cases right now in Nairobi. We have a pilot going on. We have 9 health facilities that are already using our tool. And what happens basically is every month a group of government regulators will come through the hospitals, essentially using our tools to like basically gather information about how the care is being delivered. And that goes everything from like customer service all the way down to the labs and commodities. And after that, a report is generated by a platform which both the regulators and the hospital administrators can be able to sit down and actually look at that. So as we speak right now, we have health facilities that went from like basically having zero capacity to, for instance, resuscitate unresponsive children, to now being able to understand they need to like actually buy equipment for resuscitation. They've done that, and now the capabilities in terms of just delivering that kind of service have been achieved. So that's what we're doing, and we're really excited to do it, and we want to keep growing.